Missy?
I do, Dr. Gordon. Several patients always ask me, what is the best type of filler for your lips? There's several different kinds out there, the Juvederm, the Restylane, those kind of things. What do you use to determine for the lips?
That's a good question. Juvederm and Restylane was probably the first and the most popular filler that came along.
Hmm.
That was a synthetic filler, I should say. Um, and let me just give us some background on this whole deal. When it comes to lip augmentation, for many years, a variety of implants were used to augment the lip. And these implants that were initially utilized were silicone implants. And because silicone is a plastic that, um, even though it can be very soft, and silicone implants are very soft because
Hmm.
they're gel like, the silicone implants that were used as lip implants, and even though they were thin, um, had a tendency to be exposed because they never were adequately incorporated into the tissue of the lip. And consequently, with motion and slight movements, and the fact that these implants didn't remodel and they didn't absorb to any degree at all, they would work their way to the surface and eventually become exposed or infected, and they would have to be removed. Implants, silicone implants. Then we had an experience or a period of time where Gore-Tex was
Hmm.
utilized as an implant material, and Gore-Tex is a Teflon material, and it was softer, and it had a textured surface and a surface that we thought would be more readily incorporated in that the tissues of the lip, the muscle and such would tend to grow into, and the Gore-Tex or Teflon polytetrafluoride is what the name is, implant would become incorporated that way. But even the Teflon or the Gore-Tex implant
Hmm.
also has gotten into a lot of problems. I would say 50% of the Gore-Tex implants that I would put into the lips for augmentation purposes would eventually be exposed or would move or would become a problem of some sort. So that was kind of out. And then I think it was shortly thereafter that um, um, the surgical community sort of came to the conclusion that an implant probably was not the best way to try to augment in a
Hmm.
lip. And so we started return to the thinking that a tissue of some sort, you want a bigger lip, then make the lip bigger with what's in the lip normally. So that's where fat was initially experimented with to augment a lip. Now, what would typically happen with fat grafting into the lip is that the lip would be big and duckbill like and so forth, and it truly would be something that would not be acceptable to the patient at first because the lip would be so large, and
Hmm.
then most of the fat would get reabsorbed. And I think that has a lot to do with the circulation of the lip tissue, with the constant movement of the lip and that sort of thing, that made fat not the most ideal material to use to augment the lip. So, and it was after that that materials like hyaluronic acid, which hyaluronic acid, Juvederm, Restylane, became popular, and that to this day appears to be perhaps the best material to use to augment a lip. And it's not permanent, which is a good thing. There are some materials that are more permanent that incorporate I mean, collagen was used for a while
Hmm.
for lip augmentation, and that had its problems. Like it would clump up, or if it wasn't human collagen, we were using collagen that was derived from cows for a while, and the bovine means beef or cow or whatever. That collagen, could cause some pretty severe allergic reactions as well. So that really wasn't the ideal thing either. the short answer to your question is injectables like hyaluronic acid have become very popular for lip augmentation.